Neurofeedback treatment provides real-time feedback on specific brain activity. Neurofeedback is suitable for anyone with attention, impulsivity, concentration and sleeping problems, and can be applicable for clients 6 years or older. The purpose of this treatment is to train the client to activate specific networks in the brain and to strengthen these networks in order to reduce symptoms. Disorders such as ADHD, ADD, and insomnia can be treated using this technique without medication. Prior to treatment, the client receives a clinical intake, sleep assessment, QEEG assessment, and a consultation. The complaints of the client will be assessed during the intake. Also, clients receive self-reporting questionnaires which they can complete at home. In addition to the intake, the client wears a sleep watch that records physical activity, sleep, and light. These factors often play an important role in dealing with attention problems. In some cases, as a result of indications from the sleep assessment, a treatment other than neurofeedback is required. In such cases, a referral to other treatment will be considered. The QEEG is an assessment of brain activity. During the QEEG, the client performs a number of tests. The brain activity obtained and the results of these tests will be compared with previous QEEG assessments from people of the same age and gender. Once the QEEG assessment is completed, the results will be analyzed and a report will be generated. This report will be reviewed and interpreted by the Brainclinics team. When the QEEG report is available, the client, and possibly the parents, will be consulted about the results and treatment options. The results of the QEEG and sleep assessment determine the exact protocol for the neurofeedback treatment. During the neurofeedback treatment, the client sits in front of a monitor. The therapist places electrodes on the client's head. These electrodes measure brain activity. Clients receive visual and auditory feedback based on their own brain activity. The client is rewarded with auditory and visual feedback when the right brain network activates. By visualizing brain activity in real time, the client trains to activate right brain activity. This is done by switching on and off a specific network in the brain. During these sessions, a learning process occurs, causing ADHD symptoms to reduce. On average, a neurofeedback session takes between 10 to 25 minutes. The remaining time is used for counseling and psychotherapy. After every 10th session, questionnaires are used to measure the effect of the neurofeedback treatment. Usually after 10 to 20 sessions, an improvement in sleep, attention, and impulsivity is observed. Thus, long-term effect is achieved. On average, between 30 to 40 sessions are required to obtain a lasting effect. Click on one of the treatment methods to repeat the film.